Good morning, everyone. So today I will be discussing the topic about people with special needs. This is from the core competency number 6. Okay. So caregiving, as caregivers, we do a lot of things, not only for the children, elderly, but also for people with special needs. So, ang people with special needs ay sila yung mga patients na nangangailangan ng special attention para gawin ang mga iba't ibang bagay na kailangan nila sa pang-araw-araw na pamumuhay. Ang example ng mga ito ay yung mga disabled, mga na-aksidente, mga matatanda na may sakit, okay? Hindi lang po matatanda, kundi mga bata, mga middle age, mga adults. Okay, those are examples of people with special needs. But mostly, mga matatanda or elderly ang mga nangangailangan ng care ng isang caregiver. So while caregiving can be rewarding for a compassionate person who enjoys helping others, it can also be draining. So why it can also be draining? Because of course, we do all the things for our patient. Tayo gumagawa lahat ng mga bagay-bagay, mga gawain para sa ating pasyente. Now, to lessen the physical and emotional demands of the job, a caregiver structures her day with a schedule and detailed notes and necessary breaks. So, kailangan magkaroon tayo ng schedule para sa kanila, sa ating pasyente. At magkaroon tayo ng notes para wala tayong ma-miss ng mga gawain. And, syempre, we can have a break. Okay? It's also important to take care of the health, our health as caregiver, as we take care for our patient. Not only giving a break to our patient, but also to ourselves. That's the meaning of this. So, how do we make these schedules and what do we consider? Anong ating gino-consider kapag tayo gagawa ng mga o magpaplano ng mga schedule ng ating pasyente? Okay. Isang bagay na kailangan natin alamin ay yung use of repetition. Kung halimbawa, meron tayong meal time. Okay, it should be consistent. It should be at the same time. Okay, with the use of repetition, the gets the caregiver and the patient on the same track. So, hindi mabibigla si pasyente at ito ay inaasahan na mangyayari. Halimbawa, sa breakfast, it should be same time every day. Expected na ng pasyente ang gagawin niya sa pang-araw-araw na pamumuhay, mga gawain niya in everyday para hindi siya mabigla. Okay? Para ito ma-reduce ang complaint and struggles. We need also to monitor when necessary. Monitor patient for things, activities, and food that are contraindicated. So while we want to assist them, gusto natin silang i-assist, gusto natin silang mapasaya. Sometimes, ang mga pasyente may gustong gawin, pero kontra ito o makakasama ito sa kanilang kalagayan. For example, yung food, okay, diabetic patient. Dati, gusto niya kumain ng matatamis. Pero ngayon at may diabetes na siya, nililesen or hanggat maaari hindi nakakain ng matatamis. And sweets, matatamis na pagkain ay nakakapagpasaya somehow sa kanya. So, gusto niya itong makatikim o makakain muli ng matatamis. So, hanggat gusto natin siyang pagbigyan dahil masaya siya, but we have to consider na contraindicated ito sa kanyang health, especially as ordered by the doctor or the physician. So, we have to control or activities. Mga activities nila, kung dati very active sila, halimbawa, runner siya dati, si pasyente, pero dahil nagkaroon siya ng sakit sa paa o kaya nabalda ang paa, ngayon dapat lessen na ang activity until mag-completely heal ang kanyang disabilities. So that's contraindicated. Okay. So another is foster independence. So although tayo mostly ang gagawa ng mga gawain, mga daily needs or task ng ating patient, but still as much as possible, encourage natin ang independence. Ibig sabihin, hanggat kaya pa niya gawin ang isang bagay, we will allow the patient to do so. For example, brushing teeth, or washing hands, or going to the bathroom by him or herself. So, allow natin ang independence kasi ito nakakatulong sa paggaling at saka yung self-worth, yung feeling na capable pa sila na gawin ang isang bagay. Okay. To preserve dignity or their flexibility in decision making. It's important that an elderly person feels useful and capable. So this encourages healthy behavior. Okay. So another is make eating pleasurable. So patients' dietary needs must be taken into consideration. So pay attention to inconsistency of the food, the temperature, texture, to keep dental work in place and prevent choking. Okay, if we give food to our patient like elderly, kailangan we have to consider may ngipin pa ba ito o wala na. So, kailangan yung mga pagkain niya, dapat yung mga soft or mga puree kasi hindi na siya makanguya. Okay, so we have to adjust the food that they are eating and also to prevent choking. And also we have to present food in an attractive way, of course. Losing interest in meals leads to weight loss, poor nutrition, and weakness in the immune system. So, pagka sila hindi na kumain, it can lead to weight loss. They will become unhealthy. So, their body is weakened and then they will have poor nutrition, and eventually it's hard for them to recover from their sickness. Kaya we have really to make food pleasurable or eating habits pleasurable, make the food attractive with consideration of their situation or health problem. Give proper attention. Ayan. So, eating, bathing, dressing, use of the restroom, and do any kind of activity. So, a lot of things that we have to do for our patient. Also, not only the physical needs, but the emotional needs. So, this is crucial to the caregiver and patient relationship. A patient feels loved and needed when the caregiver respects her opinions and understands her situation. Caregiver individual differences for people. So caregivers are responsible for the care and well-being of others. So some caregivers prefer to take care of child. Some prefer to take care of geriatric, meaning elderly, sa home care or medical recovery. So as caregiver, we have different preferences. So you might want to go to the elderly child care. So it depends, no, on what preference or what do we want to take care, or what clients do you want to take care. Yes, okay, empathy. So this is very, very important. We have to sense of personal understanding and empathy to our patient. So, empathy, ibig sabihin, feel natin na yung sarili natin ay nandun sa sitwasyon ng pasyente. Okay, in that sense, we can understand them more better, and then so that we can have a good or render a good care for them. Another is patience. So patience is a virtue, sabi nga, no? So people receiving care typically lack the ability to be fully independent and self-sufficient, which can lead to frustration and lashing out. So yung mga pasyente, they are really in a very low moment of their life. They're basically needing help. So we have to understand them in that situation. So what must a caregiver do? We have to separate yourself from potential anger and resentment and not take the situation personally. So if it happens that the patient put her anger to you or nagagalit siya sa'yo, let's not take it personal. Let's understand that this patient is frustrated in her life, and so we should not take it personally, because if we take it personally, baka magagalit tayo sa kanya din. So walang mangyayari. So how can we take care? So we have to really be patient. So another is we should have a realistic outlook. So having realistic expectations about what an individual under your care is capable of can help you provide individualized and appropriate care. So depends sa situation ng pasyente. We have to be realistic. Kung ano yung kailangan niya, yun ang ibibigay natin. Remember that we have to foster or encourage natin siya na maging independent din. A strong constitution or health status of a caregiver. So caregivers often deal with bodily fluids, wound care, they take care of their bathing and other personal hygiene routines of their charges or patients. A good caregiver does not shy away from delicate situations and works to help those they care while retain a sense of dignity. So wala tayong ibig sabihin arte-arte sa ating trabaho. We have to do all sorts of things. Kahit na may dugo, may bodily fluids, everything, may poops, and all those urine, we should not shy away o wag tayong mandiri sa mga bagay na iyon. Simply to say. So, this is and how to do this? How can we take care of these patients? We have to have a good health status and strong health state. Dapat healthy tayo. Our immune system as caregiver must be strong in order for us to face the reality of our work, our job. Okay. Okay, as caregiver, we should have a soothing nature. So what is soothing nature? Good caregivers know how to calm and soothe their patients. So kalmado, we have to be calm. So being a voice of encouragement is a good quality for a caregiver, as is the ability to calm and reassure those being cared for. So hindi po dapat tayo taranta. Okay, dapat kalmado. Okay, And para clear ang mind natin, ang puso, heart and mind and soul, kailangan clear para pagharap natin sa pasyente, magkaroon sila ng reassurance that they will be taken care of by a good caregiver. Okay, reliability. So reliability is vital trait in a caregiver. People receiving care come to rely on and depend upon their caregivers and often feel a sense of personal attachment. So, dapat reliable tayo na caregiver. Kailangan maasahan tayo ng ating patient. Okay, maintaining and communicating well-being of people with special needs or elderly. So, when communicating with disabled, it is important to treat them with respect and dignity. So, yung mga disabled na ating mga pasyente, we should consider them as normal human beings as we are. So, however, disabled lang sila. That's why they cannot do things. That's why kailangan nila tayo. So, that's how we give respect to them and bigyan natin sila ng dignity. People with disabilities are no less than a human being than us. Ibig sabihin, hindi sila mababa. Hindi sila mababa sa atin. We are equal. It's just that meron silang disabilities. So, in communicating, so effective verbal and nonverbal communication, for example, kung may dementia ang ating pasyente. So, we should communicate with them with short and simple words. Give instructions one step at a time. Okay. Intindihin natin na sila ay medyo nahihirapang umintindi ng salita dahil nga may dementia. Okay, ibig sabihin mayroon silang problema sa memory, sa language. Okay, neurodegenerative kasi ito. So, yun sa brain, function of brain. So, ibig sabihin slow sila na makaintindi. Kaya, short, simple, and give instruction one at a time. Okay, again, patience is a virtue. We have to really have a good, long patience to our pasyente. So, we should not try to hurry or rush things for them kasi they would feel frustrated or nervous. Okay, knowledge. It is important that we have to understand their illness, the status of their health problem or condition. Okay, and we should know what are the orders of the physicians and whatever treatments that they are undergoing. Okay. We should also be good in organizing. So, organizing medicine administration and scheduling. So, for example, meron siyang medication. We should have that like a good box for their medicines. Nalagay natin doon like Monday, Tuesday, Wednesday hanggang Saturday. So, naka-organize ang mga gamot nila. Not only that, kailangan alam natin yung important papers. Kung nasaan yung insurance nila, we have to file them in an organized way. So that kung kailangan natin, assist natin sila going to the hospital, we know kung nasaan yung power of attorney, na tayo ang magdadala sa hospital in case of emergencies, yung mga living wills and insurance nila, health insurance, kailangan dalhin natin yan sa hospital together with them. So we have to organize those documents. And, of course, yung mga appointments. As caregiver, tayo yung pinaka-frontline, pinaka-kasama ni patient. So, we have to really make a calendar or book an appointment, mark, okay, yung mga calendar natin for the appointments, medical check-ups. Okay, resourcefulness. So there should always be a dependable backup ready to provide care if the primary caregiver is unavailable. Or for example, si nurse or si doctor hindi available, so what to do? Okay, you have to be resourceful. Maybe you can write down their numbers, telephone numbers, just in case of an emergency. If they're not present, you can call them, and if you cannot call them, you have the number of the nearest hospital, like that, no? Or the caregivers should also be aware of community resources that are available to provide services. For example, may free vaccinations sa community, and then naka-order si doctor na vaccination, yung pasyente natin kailangan ng vaccine, o sabihin natin, we have a free vaccine. So be resourceful. Okay, utilize the resources around you. Okay, so these are the examples on how to communicate to our patient, no? Okay, treat an adult with a disability like an adult. Avoid speaking very slowly or using baby talk. So we can talk to them naturally. They are adult. Talk to her the same way you would with an adult friend. When speaking to a child with disabilities, talk to him the same way you would with other children his age. Spend time getting to know the child to show him you care about him. Do not be afraid to ask questions about his disability, and always display a positive attitude towards him. Listen carefully to an individual who has trouble speaking. So wait for him to finish speaking instead of interrupting and correcting him. If you do not comprehend what he is saying to you, politely ask him to repeat himself instead of pretending you understood him. Kung meron ka hindi naintindihan, you have to ask instead of pretending na alam mo yung sinabi niya. So offer to assist the person with special needs when you think she may need help. For example, as a person who is using a wheelchair, if you can open the door for her, only assist the person if she agrees. So do not assume na the person with disability cannot do a thing. So we should ask permission if they want our help. Remember that we have still to foster or encourage independence to our patient. So touch a visually impaired person, yung mga blind o hindi nakakakita, on the elbow to let him know you are speaking to him. So speak to him in a normal tone instead of shouting. Let the blind person take your arm when walking across the street together. Always mention your name when you see a blind person. Because he may not recognize your voice. So, introduce yourself before helping and ask if they want your help. So, relax. While it is normal to feel uncomfortable when first speaking to an individual with special needs, constant worry will only make the situation worse. So, if you accidentally offend the person, apologize and explain to her that you did not mean to hurt her feelings. Okay. So, caregiver role and responsibilities for people with special needs. So this includes bathing, okay, giving a bath to them, changing clothes, bed making, cleaning and washing their clothes, and cleaning their house, their room if necessary, feeding and food preparation, bowel and bladder control, ito yung pag-poops and pag-urine, and movement difficulties, okay, with the use of assistive devices. Turning in beds to prevent things like bed sores. Then we have to exercise them. Encourage exercising in range of motion kung ano lang yung kaya nila at the moment with their health condition. And lifting from beds to wheelchair, and vice versa. So those are the uh, common or most role and responsibilities natin as caregivers to our patient. So there are techniques and procedures on how to do those things, especially use of assistive devices, which the examples are these are the assistive devices that we need to be familiarized. So we have cane, we have the single cane, quad cane, crutches, walker, wheelchair, lifting or hoisting devices. So these are the important devices to assist our patient with special needs. Okay, so these are the skills. Actually, there are techniques and skills and procedures that we are going to learn about on how to use these assistive devices. So that ends my report for today, my discussion on the people with special needs. So thank you very much. If you have any question, you can just ask me and I'll try my best to answer. Thank you so much.